It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. The show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is macular degeneration. Joining me is Dr. Ganiban of the Eye Institute. Welcome, Dr. Ganiban.
Thank you.
It's a pleasure to have you here.
Pleasure to be here.
I explained to Dr. Ganiban before the show, folks, that we have done 3 or 4 shows on macular degeneration, but every doctor has made different points about macular degeneration, and that's why it's so important, because there's so many things to understand, Dr. Ganiban, and that's why we do the show. But if I ask you the question, what is macular degeneration? What do you think it is? How do you explain it to our viewers?
Well, the way I explain to your viewers is the same as I explain to my patients, is that macular degeneration is an age-related disease, first of all. It usually happens in people over the age of 55 to 65. It's a degenerative disorder that affects the center part of your vision slowly over time. So although people come in with maybe acute changes in vision and think, oh, I just got macular degeneration, it actually develops gradually over your lifetime. So when doctors see patients, when retina specialists like myself look at people's maculas in their 50s and 60s, we're looking for some age-related changes that can lead to macular degeneration. And we can see these very early on. So it's an age-related process that could start early 40s, 50s, but doesn't affect the vision until maybe into their 60s, 70s, or 80s.
Nobody's really pointed that out. See, that's what I say. Everybody brings something different. I've had it explained many ways, but macular degeneration it can start early, but the symptoms really don't manifest themselves until they're generally in their 50s or 60s.
Exactly, yeah. Just like you get spots on your skin as you get older, you can get spots on your macula. The macula is just an anatomical place in the back of your eye that we look at.
What is it? What is the macula? When you mentioned that,
Okay, yeah. So the retina is the nerve inside your eye that enables you to see. And the retina lines the inside of the eye wall, like wallpaper on a wall.
Okay.
The most central part of that wallpaper, or of the retina, is called the macula. So if you're looking straight at something and light's coming into your eye this way in the back of your eyeball, the most central area here, that's where the macula is. So it's an anatomical place in the back of the eye. And as time goes on, just like we develop spots on our skin, you could develop spots in the macula. So as a doctor, as I'm looking at someone's macula, I'm looking for those spots. And if I see those spots, we call those spots drusen. That's the medical term for them. And that's the first sign, not so much of macular degeneration, but it is an aging change of the eye. You can have these drusen and still have 20/20 vision. But slowly over time, if you get more of these drusen, the macula begins to degenerate and the vision begins to drop. And that's what macular degeneration is.
If you can see this happening, why can't they do something, or why can't something be done to reduce these spots or eliminate them? Can that be done?
Well, it can't. It's difficult, because just like we get spots in our skin, how do we stop that from happening, right? We have
retina age cream.
Yeah, retina age cream, right? So, I mean, there's things that we can do. So we talk about what causes macular degeneration, right? And no one really knows what the cause of macular degeneration is. We know that it's multifactorial. Age, as we discussed, is one of them. It's age-related. The second one is that there's going to be a family history a lot of times. It can run in families. We know that there's a genetic element to macular degeneration. A third one could be smoking. We know that smoking can make macular degeneration worse and cause the macula to age and degenerate quicker. Things like high cholesterol, hypertension, diabetes, anything that makes your body unhealthy will make your eye unhealthy also. So if my patients ask me, how do I prevent forming these drusen? I say you can't prevent it, but can we slow it down? Can we try to slow down the aging process of the eye? Well, we can't fight our age, right? We can't slow down that. We can't fight our family history and our genetic disposition to it. But you can affect things like not smoking, staying as healthy as possible, keeping your cholesterol under control, your blood pressure, blood sugar, things like this, things that keep you healthy, keep your eyes healthy. And then lastly is vitamins. We know that there's certain vitamins called antioxidants, which try to decrease the aging process of our whole body. And so antioxidants like beta-carotene, vitamin E, C, there's something called lutein, which is good, which is found in the macula, and zeaxanthin. These things are good for your eyes to try to slow down the aging process. So, although we can't stop the spots from forming, we can try to slow it down.
See? It's never been explained that way. Never. Honestly, I could go back and show you every show on macular degeneration, and you not see one doctor that explained it the way you did.
Yeah.
But that's easy to understand what you're saying.
Mm-hmm.
I have a question. Are you familiar with a vitamin called Juice Plus?
Juice Plus, yes. Mm-hmm. Sure.
Is Juice Plus good for the eyes?
Well, Juice Plus, basically you're trying to get your vitamins and the things that are good for your body in a more natural state or more natural form by using Juice Plus. And it's just another way or another vehicle to get the things that you like. The people who make Juice Plus, the people who you sell the Juice Plus, their selling point is it's more natural. It's an easier way to get the vitamins into your body, absorb better than just taking vitamins and such. So I think it's a nice product. I've used it before.
I've got 4 boxes of it at home. But
the gummy vitamins?
There's ones in the green, there's the green and purple and the red.
Yeah, it's a good product.
And our daughter sells it.
Yeah.
And what I liked, I was going to have a dental implant, and the surgeon was going to do the implant. He believes in Juice Plus. So he gave me one of the milkshake packages. And he said, I want you to have a milkshake every day for 30 days before I do this work. He's that strong a believer in it. Mm-hmm. So
I do think that taking things more naturally is probably better than taking the vitamins, but unfortunately, we all don't have such great diets. Juice Plus is one way you could supplement your diet to get things that you like. But there are standard amounts of vitamins that are recommended for macular.
That's the hard thing.
Yeah.
The reason I ask the Juice Plus question, because I know that it's the natural part of it, but what are you mentioned vitamins, mm-hmm. but say again the vitamins that are really good for people to take.
So back almost 30 years ago now, there was research done looking at thousands of people with macular degeneration, following them over a 7-year time period, and putting them on certain vitamins to see if it would affect the macular degeneration. And what was found was that by following these people for 7 years, that you can decrease or you can stop the progression of macular degeneration in only about 25% of people who take the vitamins. So although it's not great, it does help, maybe gives you about 25% added protection than if you don't take the vitamins. So what are the vitamins? The vitamins are A, or beta-carotene, E, C, and zinc. Those were the original ones.
Zinc?
A, E, C, and zinc, right. And so there are vitamins made now that you can buy at CVS or Walgreens or even Walmart that have a combination of those vitamins, because that's what the study was done with. There's only one company that actually has the patent on the exact formula that they studied, right? And that's Bausch & Lomb has something called Preservision. And all the other ones are very similar, but because Bausch & Lomb is the only one that has the patent, they have the exact formula. But all these companies now make eye vitamins that pretty much have the same stuff in it. So we're going back, 25 years or so, 30 years. That was in 1988, I think, is when the vitamin first came out. Now, more recently, and that was called the AREDS. Okay, that's the nickname for it, AREDS. There's now something called AREDS 2, which has the vitamins in it, but it also has lutein and zeaxanthin. So there's a couple added minerals to it that are supposed to be good for the eye. So I'd say to your audience, or what I tell my patients is if you have moderate to severe macular degeneration, you should be on these AREDS 2 vitamins, and you can get them in the store. Yeah.
It's amazing. And if only 25% are helped, that's still a tremendous
amount of people.
Especially if you're one of the 25% that's getting helped.
Yeah.
And it's something how do people know, or is it possible to tell if you're slowing down? Can you see that then?
If the macular degeneration is slowing down, well, you can't tell it. Even as doctors, we can never see. we can't see drusen slowing down or reversing. All we can follow is how many drusen, how many spots, how much macular degeneration are developing over time.
Okay.
And that's such an individual thing. There's some people who I may see for the first time when they're 65 years old with a few drusen, and now I've been doing this for 25 years, and I can see them 20 years later, and they hardly have any more drusen they did, 20 years earlier, right? And then I have some patients who I may have seen 20 years ago and are now legally blind from the disease, right? Because there's progress. It's an individual thing. Some people progress, some people don't.
It's kind of like when I have shows with dentists and talk about periodontal disease. People don't understand the seriousness of periodontal disease and the fact of early on treatment is so important. The same thing with eye disease.
Well, a lot of eye diseases, and with macular degeneration, you can't treat macular degeneration with these vitamins. I don't want to leave you with that impression. It's only recommended for people who already have moderate to severe macular degeneration. So it's not a preventative for people who just have a couple of these drusen or who have early degeneration. The research only showed that these high-dose vitamins should only be used in people who already have degeneration, moderate to severe, and your doctor will tell you if you're one of those people. If you don't have moderate to severe macular degeneration, just taking a good multivitamin or Juice Plus or staying healthy, things like that, is what's recommended.
But, you raise a good point. I think that people might have a propensity to go into a drugstore and buy vitamins because they've heard somebody say something.
Right.
I think there's a danger, and vitamins can do harm as well as good.
Absolutely. Yeah.
So I don't take anything unless I talk to my cardiologist and my primary care physician. I don't care what it is.
It's true. Yeah, because there are some vitamins that we call water soluble that you can take a lot of, but your body just gets rid of. And there's some other vitamins that your body actually stores. So if you take a lot of, say, vitamin E or vitamin A, these are things that your body doesn't get rid of as easily or as quickly as, say, a vitamin C, and can be stored in your liver and cause problems like increased bleeding times. Or so if you're on aspirin therapy or you're on Coumadin and you take some vitamins, they could actually increase your propensity to bleed.
And
thin your blood more.
That's why, because
it's always good, even as a retina specialist, if I see someone with macular degeneration and I want to put them on these high dose vitamins, you always have to run it by their primary care doctor. Let the patients know that because they're on blood thinners, they have to get this approved by their primary care doctors before they should start them. For that reason, it could affect people who are on Coumadin have to get monthly levels checked to make sure that their Coumadin is good and that they're not taking too much of it because their blood can get too thin. So if you're taking a vitamin that could affect that, next thing you know, their blood's way thin and they have to decrease their Coumadin because they're taking that vitamin. So it's important to know that these vitamins aren't completely benign and that there are some vitamins that can affect you systemically with other things. So run it by your doctor first.
Is there more than one type of macular degeneration?
Well, there's two basic types of macular degeneration. There's a dry kind and a wet kind. A dry kind is when you have those drusen, those spots, and the spots are accumulating in the center part of your vision, and your vision begins to drop. Slowly over time, as you form more spots, the vision can get more blurred. And we're just talking about the central vision, right, in the macula. Typically, the side vision is okay. It's just the central vision. And so that's the dry kind of degeneration, which usually happens over years. At any time, any of those little spots, any of those little drusen could actually bleed or leak. And if they begin to bleed, then that's called wet macular degeneration. And when that happens, there's usually a very sudden change in vision. There's going to be a distortion where you're looking at a straight line. Say you're looking at the blinds in your kitchen, and all of a sudden you see this wave in a blind, or the white tile on your floor, and you see a wavy line. That distortion could be a sign that one of those spots, those drusen, actually bled or leaked. And that's what we call wet macular degeneration.
What can you do to treat? Can you treat macular?
So as we discussed up to that now, we were talking about the vitamins and dry macular degeneration. We're talking about the drusen and things like that. For wet macular degeneration, it's a completely different treatment. So for wet macular degeneration, in the past, there was, when I first started doing this in 1990, the treatment was laser. And what we would do is we'd see that bleeding spot in the back of the eye, and we would laser it. But when you laser something, you leave a scar. And so if someone's bleeding in the center part of their vision, and you laser that, you're going to leave a scar in the center part of the vision. I could stop that bleeding with the laser, but that person will have a permanent scar in the center part of the vision. And from 1985 until about 2001, that was the only treatment for wet macular degeneration, was to laser the spots. And a lot of people lost vision immediately when we lasered those spots. But if they lost a little bit of vision because we lasered that spot, we'd try to save the rest of it. But it wasn't a good treatment because not only did people lose vision doing it, but it always came back. So you would laser it, and it would come back right on the edge of the laser scar, and you'd be lasering it, you'd be chasing it. Just always the dog chasing its tail, and patients would eventually lose a lot of central vision. Then in 2001, a new treatment came out, and it was called photodynamic therapy. And that was a treatment where we gave people medicine through an IV. The medicine traveled up to the bleeding area of the eye and socked itself right into where the bleeding was. And then we activated that medicine by shining a light, a special wavelength laser light, into the eye, right where it was bleeding, would activate that medicine and stop the bleeding. Although
it stopped the bleeding?
It would stop the bleeding. Although it sounds great, it only worked in about 10, 11% of people. And in most people, it didn't work. And so we had that from about 2001 to about 2005, when we have the treatments that we have today. And what these treatments are little drops of medicine that we actually have to inject in the eye, which stop bleeding and leaking blood vessels. And these medicines work great, better than anything we've had before. They work 90% of the time to stabilize and stop the bleeding macular degeneration. And almost 50% of the time, people get their vision back. They can regain vision.
Regain vision?
Regain vision from it, yeah, from the wet degeneration. Because remember, when you get the wet macular degeneration, you lose vision. Something happens, distortion, blurriness. And almost 50% of the time when we treat it, we can get that back. And 90% of the time, at least we could stabilize it so it doesn't get worse.
What are they looking at now? I assume that research is going on all the time.
Oh, yeah. Research in macular degeneration is huge right now. And there's so much, since we had these injectable medicines. And right now we have 2 injectable medicines which are approved by the FDA for the purpose of macular degeneration. We have a third one that never went through clinical trials to be approved by the FDA for macular degeneration, but it was one of the first ones to be used. And now it's almost a standard of care. Like, everyone can use it for macular degeneration, even though it wasn't approved by the FDA. Everyone uses it now, and we know that it's safe. So we have 3 medicines that we can inject in the eye to treat macular degeneration. The bad thing about these medicines, number one, is that we can stabilize people 90% of the time, but only 40 to 50% of people get better, right? So you have another 50 to 60% of people who can get worse, even on the medicine. That's one bad thing. The second thing is that you have to inject the medicine every 4 to 8 weeks. So it's not a cure for macular degeneration. It's more like a therapy. So people have to come into the office every 4 to 8 weeks to get a treatment. And this goes on for years. There's some people who don't need it all the time, but the average number of treatments in the first year is going to be 7 to 9 treatments. So it's very it's a rigorous therapy. It's very demanding for the patient to come to the offices, and because of this treatment, a lot of doctors, retina specialists who are doing this treatment are inundated with all these injections that we have to do all week long. So we're seeing more and more patients who do these injections. So it's very taxing on the whole system, but it works, right? So could we make this better? And that's what the research is going. Number one, we have to make the medicine better so that it helps it can improve the vision of more than 40 to 50% of people. So that it can stabilize 100% of people. That would be great. And so there's a lot of research going on with new medicines, different medicines that either work very similarly or work in different ways to stop the bleeding macular degeneration. And there's a number of medicines in the pipeline, and there's probably going to be a few that actually come out for clinical use within the next 3 to 5 years. So there's a lot of research going on these kind of medicines. The other research that's going on is to look at more preventative ways, or look at people who already have macular degeneration. How can we get that vision back? People who have lost vision. How can we get some of that vision back?
That was what I was going to ask.
Yeah, and so the research going on there, and everyone hears about, and it's the key phrase is stem cells, right? Everyone wants to know, when are stem cells going to be ready to bring back my vision? And so there's a lot of research going on with stem cells. A stem cell, think of it as like an immature cell that doesn't know what it wants to be. It's a cell. If you put it next to another vision cell, the vision cell gives it a message to say, turn into a vision cell, and that stem cell turns into a vision cell. So the theory is you take a bunch of these stem cells, you put them in the eye, they turn into vision cells, and they bring back vision, right? So it sounds very simple, but it's not that easy, because you can inject stem cells into the eye, and your eye just removes them. The key to the research is to try to find out how you can implant these stem cells in the correct place so they actually turn into vision cells and stay viable and stay alive, and actually restore vision.
How do you inject? I know you guys, to a layperson like me, and you're sitting there, and I've had your eye doctors very calmly talk about making a cut in the eye and take this out. And to me, we're all thinking, if the eyeball is punctured, you lose your sight.
Right.
But that's not true.
No. So anatomically, we know that there's a safe place that we can inject medicine into the eye without releasing fluid, without causing other problems, bleeding, retinal detachments, things like that in the eye. So we know exactly where. There's this very specific place to be able to inject these medicines.
How do you
safely.
How do you do that with? How do you see where to put that medicine? And can you do it painlessly?
Painlessly. So some doctors, we all do it differently. Some doctors will numb your eye just with an eye drop and then give you the injection. But I found a lot of patients still feel the injection if I just give them an eye drop. So I give them similar to a dentist, gives you a little Novocaine so you don't feel them drilling on your teeth. So I give my patients just a small little Novocaine shot, or lidocaine, we call it, right on the white part of the eye. And that numbs it up so well that when I give the shot, and the shot goes in the white part of the eye, it's actually 4 millimeters behind the blue or brown part of your eye, on the white part of your eye there,
on the side,
on the
eyeball itself.
On the eyeball itself. We measure a little area there and give you the shot right there. And the needle is so small and thin that after you give the injection, you just come out and the medicine's in there and nothing.
How do you keep the eyeball still to do that?
Patients will hold still, yeah. I say, look up, they look up, and they hold still. Yeah, but they don't feel anything. Even after I give the injection, the patients say to me, did you do it yet? They don't feel anything.
It's hard for me to sit here and listen to you talk and say that and visualize no reaction.
Right.
It's hard.
Yeah.
And I think that when you start talking about cataract surgery or glaucoma surgery, it's all amazing what research has done over the years, especially in treatment of the eye. And yet we talk so little about it. And the eye is so important to life.
Yeah, yeah.
And there's just a lot you can do. The way you've explained it has made it very easy to understand a very, very difficult topic. What else? What didn't I ask you, or what didn't you? I was going to look at my notes and see. But what else? You mentioned diabetes, but the other part of this question was, you talked about the research.
People may want to know about, they hear about the bionic eye. I have a lot of patients ask me about, because they've seen it on ABC News or something, a news report. And there's research going on. There's actually some implants now to try to help people with macular degeneration, to try to bring back their vision. But the detail in the vision that we're getting back now with these type of devices isn't what you think it is. It's not 20/20 vision. It's not clear vision. We're taking people who can't see much at all and giving them back shapes and movement and things like that, but not vision like we want to have it. It's not there yet. But there are different implants and different what we call bionic eyes that are being looked at and researched to try to bring back vision in people who have lost it, not from just macular degeneration, but also from other diseases. Something called retinitis pigmentosa is another important one.
The reason I ask that is we take a gentleman to church and he has macular degeneration, and we learn a lot from him about devices that are, we're just almost out of time. That's the problem. It goes so fast. Yeah. We'll have to come back and talk about it some more. But there's 26 seconds. Okay. What was the last? What would be the single most important thing you think people should do?
I think getting regular eye exams. If you don't have any eye problems at all and you haven't had an eye exam in at least 2 years, get an eye exam. If you're over the age of 55, have a good eye exam with your eyes dilated. Just don't get checked for glasses. But the best preventative thing is to have a good eye exam.
Okay.
Yeah.
Thank you, Dr. Ganiban.
Okay.
I appreciate it very much.
Right.
I learned an awful lot myself.
All right.
And viewer, I want you to thank you for watching today's episode of Helping Seniors. I hope you enjoyed it. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.